Very well. Good morning to all of you from the headquarters of the Pan American Health Organization in Washington. Welcome to this weekly briefing on the COVID-19 pandemic in the region of the Americas. My name is Sebastián Oriel from the Communications Department of PAHO. Some of our spokesmen are with us here today at the PAHO headquarters, and others are connected from their homes, all following the physical distancing recommendations. We do have interpretation into English and Spanish, and this session can also be followed through our social networks on Facebook and Twitter. We remind you that the session will last 45 minutes, and we will be receiving questions till about 11:45 this morning. Today, we have the PAHO director, Dr. Carissa Etienne, who will report to you on the current situation of the pandemic in the region. And she's with her, the assistant director, Mr. Jarbas Barboso, the director of the Health Emergencies Department, Siguro Ugartes, and the director of Communicable Diseases, Marcos Espinal, as well as the assistant director of the Emergency Department of PAHO and manager of the COVID-19 incident, Silvan Alighieri. I'd like to invite Dr. Etienne to say her opening words. Dr. Etienne? Quisiera darles una perspectiva general para luego centrarnos en las recomendaciones actualizadas de la OPS sobre distanciamiento social. Al 13 de abril hemos visto 610.744 casos confirmados del COVID-19 y 23.753 personas que han perdido sus vidas. Hemos visto un aumento importante en el número de casos y fatalidades en la región.
There is an urgent need for countries to and expand testing for a more accurate understanding of the pandemic in the Americas. Now, 54 countries and territories are reporting cases, and community mission is being led by a growing country in all of the subregions of the Americas: North America, Central America, South America, and the Caribbean. COVID-19 has yet to hit with full force in our region, particularly in Latin America and the Caribbean, and we expect it to intensify in the next few weeks. Indeed, the rise in hospitalizations and deaths that we see in some countries highlights how quickly the situation could change. We must act with urgency before the storm hits most of our countries to protect ourselves, our families, and our communities. The cost of inaction has never been greater. We need immediate action to address both short-term and long-term needs. In the short term, there is a dire need to expand ICU capacity in the region. Just this morning, PAHO held a virtual meeting on the delivery and management of intensive care for COVID-19, where ministers of health had the opportunity to learn firsthand from experts in China, Spain, and other countries that had been managing their outbreak. We are building on our Ibero-American network to support the COVID-19 response in the region, and we will continue to do so. In the long term, we need to plan now to guarantee that drugs and vaccines that are being developed are accessible to all in our region, especially in the most vulnerable communities. I want to take this opportunity to commend the President of Costa Rica, Carlos Alvarado Quesada, for his proposal for WHO to establish a pool of patients, a mechanism to ensure a pool of patents, a mechanism to ensure equitable access to critical medical supplies that will allow us to fight this pandemic and future wars. The WHO Pandemic Influenza Preparedness Framework that was approved in 2011 also presents a solid foundation for the global community to facilitate future access to new tools. These mechanisms of global solidarity allow us to balance the need for speedy innovation and equitable access. Now, I would like to focus on something we are all engaged in: social distancing. This remains our best bet to reduce transmission and slow the spread of the virus in our communities. It prevents hospitals from being overwhelmed by too many sick people at the same time, and it also keeps doctors and nurses from having to make a terrible choice about which patients receive care and which patients do not. It is also a way to buy time for new treatments, medicines, and vaccines that will allow us to fight COVID 19 and recover from it. In short, physical distancing measures give our societies a chance to respond to the pandemic. Following these measures is not easy, and it will be tough on our economy and our way of life. But the pandemic has taught us that these measures work. PAHO's recommendation for issuing on physical distancing, we issue those because we know that they can slow the spread of COVID 19. And those recommendations are aligned with those that were recently released by WHO. And we are working with ministries of health to help them implement these at country level. There is no one size fits all approach. It's impossible to apply the same measures from Alaska to Tierra del Fuego. However, countries need to keep that in mind. They need to ensure that many of our countries in the region who have already implemented community-wide social distances, that they are allowing health services to operate within the capacity. This is encouraging, but it must be sustained, over a period of time to be effective. Following a period of social distancing, any attempt to transition to more flexible measures should be taken with extreme caution. Such decisions should always be informed by disease transmission patterns, by COVID 19 testing availability and contact tracing capacity, the availability of hospital beds, and other objective criteria. Social distancing needs to be accompanied by comprehensive measures to ensure the most vulnerable can comply without severe risk to their livelihoods. This will require an adequate national and logistical capacity to ensure the delivery of medicines, food, and other supplies for our populations. Implementing the measures required to stop COVID 19 can be disruptive, but failing to do so will risk prolonging this crisis. Interrupting recommended social distancing could have the opposite effect and lead to a second wave of COVID 19 cases, extending suffering and socioeconomic uncertainty over the long term in the region of the Americas. Make no mistake, economic activity will only return in full swing when people feel safe, when they feel confident that their governments are doing all they can to protect them and their loved ones. I urge the leadership in our region to earn this confidence by being rigorous, evidence driven, and transparent in the fight against this pandemic. Only by implementing the interventions required for each setting, guided by science and solidarity, only then can we slow down and ultimately break the spread of COVID 19 in our region. And then together, within and across our countries, we can then safely get back on our feet. Thank you for this opportunity.
Muchas gracias, doctora Etienne.
Thank you, Dr. Etienne. And we'll now begin with the questions we've been receiving through the email, and then we'll go to the chat. So don't hesitate to put your questions in the chat in English or in Spanish. We will be receiving both. Please put your name and your media. Remember that we can stay here till about 11:45 Washington time. So we'll answer most of the questions up until then. We'll ask the first question, which is in English.
Pregunta,
And it says, from Jim Weiss,
Amy Gerald is asking, what is PAHO doing to help countries obtain the reagents that need to perform PCR tests? A number of countries say that while they have testing capacity, they are running out of reagents. Dr. Etienne?
did you hear the question, Dr. Etienne? I believe they're asking about the reagents. The countries are complaining about the fact that they don't have the reagents. Dr. Alighieri is going to answer the question.
Yes, thank you for the question, colleague from the Miami Herald. The importance of testing and having people tested, it's key to the response to the COVID pandemic in the region of the Americas. We need access to testing. Since late January, Pan American Health Organization has provided 36 countries and territories with more than 100,000 PCR tests. Next week, PAHO will dispatch 1.5 million tests PCR to the countries. And in addition, before the end of April, PAHO is planning to dispatch 3 million PCR tests plus the reagents in order to strengthen the laboratory surveillance networks in its member states. However, it is important that countries plan the expansion of their network through existing and new testing machines in hospitals and clinics. To do so, countries can access reagents through the PAHO Strategic Fund. And PAHO is working closely with producers through its PAHO Strategic Fund in order to expand the options of the countries. Thank you.
Gracias, Dr. Alighieri.
Thank you, Dr. Alighieri. I think we are having several technical problems and we apologize for this. We are trying to correct this. Hopefully you can hear us. The next question is from Ana Lucia Ola from the Latina Press in Guatemala, who asks, could you tell me what's the risk of having asymptomatic patients with the virus? An asymptomatic patient with a new coronavirus could infect how many people? And also asks about the use of the generalized use of the mask in the community as well as the social distancing. Can they truly contribute to these asymptomatic patients not contaminate others? Yes, and thank you very much for your question. It's important to mention that the main vehicle of transmission of COVID-19 is those who have symptoms. The symptomatic patients, which are the majority of the cases. However, there is evidence showing that there is a group of pre-symptomatic persons who do not develop the symptoms during the first days and are able to transmit the virus. We've seen it from some of the Chinese contacts as well as from other studies. What we still don't know yet, and we've not been able to determine, is whether a completely asymptomatic person would have a certain degree of transmission. That's why it's so important to continue with the social distancing measures, the use of masks amongst the health workers, and people who are sick. It has been shown with data that in persons who began with no symptoms and were diagnosed, 75% of them have eventually developed the symptoms. In other words, 25% who do not develop symptoms will eventually develop it. So the fact is that we still don't clearly have the exact percentage of persons who are completely asymptomatic and can actually communicate the disease. But as I said, the main vehicle is the symptomatic. We will understand this better when the laboratory tests, as my colleague Dr. Alighieri just said, are more massified, and we're able to expand the use of these laboratory tests in our countries as well as in others, which is what we're working on right now. And then we'll be able to really determine with a greater efficacy what's the percentage of potential asymptomatic cases and the possible transmission. Thank you very much. Thank you, Dr. Espinal. Our next question is from Bolivia, Elga Velasco from the Unitel network. Isolation and quarantine are measures that help curb the spread of coronavirus. What does the PAHO recommend to countries like Bolivia, to extend this? Dr. Barbosa might be able to answer the question. He's connected. Thank you for the question. It's very important for all the countries, not only for Bolivia. The social distancing measures or physical distancing have a very important role and must be adopted from the very beginning of community transmission. The greatest guideline we have is social distancing to curb the transmission, so that we will not have such a wave of transmission, and thus only the most severe patients who are going to need the ICU beds or the mechanical ventilators will not exceed the capacity of the health services. Each national authority must assess the transmission to decide when is the right moment to adopt these measures. In the region, we still have, in South America, all countries having community transmission. In Central America and the Caribbean, the transmission is very limited, or they're secondary cases. So it's really very important to do that assessment. We have to recognize that these are very important measures, and we have to analyze which is its effectiveness and what are the other measures to be taken. It's still very important for us not to forget the preparedness of the health services, either public or private sector, and all the different members of the health system of a country, so that we have every possible availability of ICU beds, ventilators, and other measures necessary for the very sick patients. Thank you very much. Thank you, Dr. Barbosa. Our next question is from Costa Rica. Liliane Sanchez from the UCR channel asking what is PAHO taking to manage the purchase of the PPEs for the health providers and patients in ICU due to the avalanche of purchases from some countries, leaving others with less resources unprotected. Dr. Ugarte. Thank you very much for your question. It's a very important one, in fact. PAHO announced to all countries that the need of the health providers was very high. This was done at the end of January to give priority to the purchase of the PPEs. However, the situation has improved considerably, and I'd like to mention that PAHO has purchasing mechanisms through the strategic fund that have mobilized. However, the mobilization team of the Emergency Operations Center mobilized all the PPEs available in the humanitarian store, which we have in Panama, sending them to all the different countries for the treatment of the first cases of COVID-19. However, it's insufficient. Some countries are currently having difficulties in finding the PPEs. Additional equipment has been sent, particularly to those countries that have had a massive increase in cases like Ecuador, and countries that have not as strong health services. Hence, priority of additional equipment has been given to these countries. We all know that we have to give priority regarding the availability of the PPEs that we currently have in the countries to protect the health staff, which is our first line of defense. There are purchases that are taking place. There are shipments that are taking place, but there are difficulties and logistics to get these equipments to the countries with less resources. Thank you very much. Thank you, Dr. Ugarte. We've received a lot of questions. Some are very similar. We have one question. Maybe you'd like to add something. This is a question from Anatoly Urmanaev from the who asks in English.
How would you describe the availability of COVID tests critical medical inputs in the region? As Latin America was arguably the last region to see a surge in cases, there are growing indications that governments are struggling to procure the necessary tests, ventilators. Is that the case?
This is a very important question, and regarding lab tests, I would like to pass the word to Dr. Silvana Alighieri.
Yes, thank you for the question. Mid-January, exactly on the 15th of January, the German team based at the Hospital La Charité in Berlin published a laboratory protocol for testing the new coronavirus. Immediately, Pan American Health Organization started procurement of reagents, primary probes, and control with the assistance of the Berlin University Hospital, and trained and equipped the countries of the region. Before the end of February, PAHO was able to train 29 national public health laboratories in the region. This number has increased since then. And we are doing everything what we can, complex markets at the moment, to provide the national laboratories and their national networks with this crucial reagents for monitoring the pandemic and testing the patients. This is what we can say regarding the situation in the region of the Americas regarding logistics for testing. Thank you.
Gracias, Dr. Alighieri.
Thank you, Dr. Alighieri. The next question comes from Diana Tinghaka from the EFE News Agency, asking, some countries are concerned due to the growing number of deaths of physicians and protests from the requiring protection equipment. What's the situation of the physicians as the pandemic advances in Latin America? What recommendations do you have, Dr. Barbosa? Thank you for that question. The protection of health professionals is fundamental. First, because the health professionals, with all the PPE equipment and with all the necessary technical recommendations offered by PAHO, must be followed so that they can continue to offer the good service saving the lives of people. So the protection of these professionals is highly important. From the very beginning of the pandemic, PAHO has sent the guidelines regarding the PPE equipment and all the additional recommendations necessary for them to have in every hospital and every place in the countries receiving COVID-19 patients, the available equipment for the health professionals. They must have priority with certain inputs like the surgical masks. they must be reserved for them. So it's important to have data from all the different countries when there's an outbreak in a hospital or health professional who may be infected with COVID-19, to assess exactly what is necessary to improve the situation and perfect the conditions to avoid future transmission to the health professionals. Thank you very much. Thank you very much, Dr. Barbosa. The next question comes from the newspaper Sin Embargo from Mexico, and it's Guadalupe Fuentes who asks, do you have any estimate of what countries in America will be the most affected by this pandemic? Dr. Espinal? Thank you for your question. What we've seen already is that there are some countries like Brazil where there are 22,000 cases, Peru, about 10,000 detected cases, followed very closely by Ecuador and Chile, and then Panama, Dominican Republic. But that doesn't mean they are the most affected countries, because as we've said, there's scarcity of tests, and all efforts are being made to increase the number of tests. But the countries must speed up the number of tests, because that will determine the actual level of the case histories. It's not the same, for example, if we see a country like Chile, who's done 85,000 tests to date, where they've been able to determine that they have 10,000 cases. What's really important is that they continue to apply the necessary measures. We see an increase in all the countries at this time, and they're all going to be affected. I don't believe I could say that some countries might be more affected than others. That would be very difficult to do. What we do know is that there is community transmission in the region quite broadly, and the message is that the countries must continue to prepare, not give in, continue to work, because there will be an increase in the number of cases without a doubt. But as we say, in the region, Brazil is the one that's presented the largest number of cases, about 22,000. But we must also take into consideration the number of people. Brazil is a very large country with a very large number of inhabitants, which must also be taken into consideration when making the estimates and analysis. Later on, when we begin to increase the number of detections and number of tests done in the region, we might be able to carry out a more feasible or more clear analysis of the size of the outbreak in the region of the Americas. We mustn't forget that the United States and Canada also have, mainly in the United States, the largest number of cases in the region. Thank you very much. Thank you, Dr. Espinal. We're receiving many questions through the chat, some on similar subjects, as I said. The next question in English is,
if PAHO, are you concerned about the growing negative responses coming from the United States government around WHO leadership and transparency, especially when it comes to China? Maybe, Dr. Etienne, you can take this.
Of course, WHO is a member state organization. To address this pandemic, WHO, member states, civil society, private sector, all other sectors must be fully engaged. This is not the time for WHO to take its eyes off the pandemic. We must continue to work. We must continue to work with great focus, both in WHO, by extension PAHO, so that we can accompany member states to address successfully COVID-19. I am sure that member states may well want to evaluate what has been our response, what are the lessons learned, but in the meantime, we need to continue to work with our member states. PAHO is doing just that. We are not losing focus. We are country focused. That means we are working assiduously with all of our member states to help them to acquire the resources that they would need to help them in the technical aspects of COVID-19, to improve their capacity and quality of service. And this, I think, is what we as a member state organization will be doing now. Thank you.
Muchas gracias, doctora Etienne.
Thank you, Dr. Etienne. The next question on the chat comes from Alvinson Linares, correspondent from Telemundo, who says, we've carried out a series of the health conditions in countries like Nicaragua, El Salvador, Honduras, and Guatemala, and there are no more than 200 ventilators for the population in each one of these countries. And the medical staff complains that they don't have the input to diagnose or treat the patients. What does PAHO recommend to these governments who have very few ICUs and very few mechanical ventilators? Dr. Barbosa might answer that question, maybe? Thank you for that question. The COVID-19 pandemic may be difficult for even the health systems in developed countries. We learned with Italy and with New York and with some of the cities in Europe that community transmission is very fast and reaches a certain level, even in rich and highly developed countries, and that's a challenge in the health systems of any country. That's why it's so important to take the measures of social distancing seriously and adapt it to the needs and realities of each country, but at a very early stage to the speed of the transmission and avoid having the health systems reach their capacity. And we must prepare the health services. I'm sure that in some of the countries who have weaker health systems, they'll have to probably face more difficulties. And in that case, PAHO is offering differentiated cooperation, particularly for those countries who need the diagnostic laboratory test, which, as we mentioned, we've already distributed more than 500,000, and we have another 1.5 coming in for next week. They will be sent to the countries that are most in need of them. PAHO has used its emergency stock to send the PPE for the management of the first cases. So we have to mobilize international solidarity so that the countries that are facing greater challenges and have more difficult health systems, equitable access to the medical input necessary to positively respond to the COVID-19 pandemic. Thank you very much. Thank you, Dr. Barbosa. The next question in the chat is from Ángel Rivas from the ACOTE agency in Guatemala. These are two questions related, asking how many tests donated to the countries of the Americas in total, and is PAHO following up on the use of the test after the donation, or does it end with the delivery and each state is responsible for the way in which they use it? Dr. Yeti? Yes, thank you for the question. And the answer applies to all countries. As I said initially, we focused our work since the end of January on strengthening the existing laboratories and networks in Central America. It was done in cooperation with the Reference Diagnostic Institute in Mexico, and we've trained all the countries of Central America and the Spanish-speaking Caribbean. We are regularly delivering, and I think we're at the 5th shipment now of molecular tests, as well as acquiring in the international market extraction DNA extraction kits and enzymes for those countries. Our work is not limited to the simple purchase and delivery. Each delivery is followed up by a group of PAHO virologists remotely through all the media that we have available, including video conferencing, to ensure the correct operation of these tests. What we call in English troubleshooting. Every laboratory has access 7 days a week to a group of PAHO virologists to recalibrate, reorient, and ensure the greatest quality of their work for confirmation or investigation. Thank you very much. May I add something? I'd like to add to what my colleague said. I think it's important that we remember that PAHO has country offices in most countries, and the follow-up is done from our country offices as well, because we have experts in infectious diseases and emergencies in all our country offices. So it's not only the virologists that we have here at headquarters. Our PWRs or our country representatives are in contact with the health ministries and the units that follow up the outbreak in all the countries. Not only the testing, but the number of infected persons and daily keep contact with the national authorities. Thank you very much. Thank you. The next question is from CNN in Spanish from Nicaragua, asking about the voluntary distancing. The government has limited the house-to-house visits. Is it recommended? Dr. Ugarte? Thank you. Control of the pandemic leads to fundamental aspects, such as first, the detection of persons that could be carriers of COVID-19, for which a need to implement epidemiologic surveillance and the establishment of a diagnostic strategy with the sample taking and the sampling done correctly. Those detected must be isolated. And in a specific way. Isolation means that no one can either go in or out from those places where these people are found, unless they have the adequate PPE. If it's detected that there are people with those people and were not protected during that contact, these people must go into quarantine. And I say this because it's extremely important to understand that if these measures are carried out strictly in keeping with the procedures and the standards and rules, the social distancing would be a complementary element, but extremely useful to help the countries reduce the curve of the epidemic transmission. That's why social distancing in most countries of the world is being applied to protect not only the population, but our most valuable resources that are the health resources and staff, which, as Dr. Jadwas Barbosa said, in some countries are easily exceeded when we lose our ability to curb the spread of the virus in the countries. Thank you very much. Thank you, Dr. Ugarte. The next question, Amanda Munoz from Diaria Uruguay. And I ask, how do you account for deaths due to COVID-19 when there's a strong incidence of the baseline disease and COVID-19? What does PAHO or WHO suggest we do? Dr. Barbosa? Thank you for that question. There are rules that have been distributed amongst the doctors on how to fill in the death certificates. In the certificate, you put the basic cause and then the other causes that contributed to the death. So a person who's had a diagnosis of COVID-19 plus hypertension, the death is due to pneumonia caused by COVID-19. The patient, following the universal recommendations, which are established by the World Health Organization, will fill in the certificate as basic cause, COVID-19, and secondary cause, hypertension. Other doctors have the information, and this is very important to carry out comparability between the countries. In other words, the number of deaths in one country compared to the number of deaths in another country. Thank you very much. Thank you, Dr. Barbosa. We have several questions related to Mexico from El Sol, from Milenio, and from the 8th, La Octava. One of the questions from Milenio Television asks, there are 1,414 patients and 330 deaths. Does PAHO consider phase 3 should be established already? Or when should Mexico get into the emergency stage? Maybe Dr. Barbosa? Yes, thank you. Thank you for that question. Actually, the decision as to declare it a national emergency is in the hands of the national authority of the country. We have country offices practically in all countries in the region, including Mexico, and our work is to support the national authorities to assess the data and the situation and support them in making the appropriate decisions. When we have a death rate which seems very high, two things could be happening. Either the number of cases are not being detected adequately, so the number of deaths might not be real, and the number of cases may not be appropriate. So, and this is happening in several countries of the world. At the same time, it's also important to monitor what's actually happening in the health services. This is data that all ministries are monitoring, and we're offering technical cooperation to evaluate the situation and support them in making the necessary decisions in each country so that they make them at the right time according to the legislations of each country. Thank you very much. Thank you, Dr. Barbosa. We're coming close to the end of our session. The last question for today will be from Matias Loewy from Medscape and Forbes in Argentina, who asks, though uncertainty regarding each new virus or emerging epidemic is expectable, what is the aspect of the spread of this pandemic that has most surprised you? What have we learned in future or for future epidemics? Dr. Etienne, would you like to answer that question?
Thank you for that question. Certainly, for us, the rate and the magnitude of transmission has been certainly one of the areas that has impressed us. The volume of infected cases and the run on our healthcare systems and their ability to cope. In PAHO, maybe we were not totally surprised. Somewhere in November, we just felt that it was time to review our pandemic planning. And so in November, we did call up our emergency personnel to say, please dig up our pandemic plans. In December, first week in December, those were presented to the senior advisory group and to executive management. And our instruction was to go work with every member state to revise their plans and to begin to plan. But let me say though, despite that it was almost difficult to predict the magnitude of this pandemic. This pandemic has really surpassed maybe all of the others that we have in terms of its magnitude. I also was surprised by our inability to provide for the resources in terms of PPEs, masks, tests, etc. And the almost market failure that occurred in respect of these required resources. Despite that, I think the world is facing this. We had lessons learned from our severe acute respiratory infection surveillance network that we've had. As I said, we have worked with our member states to face many other many other outbreaks and responses. So in a way, in the PAHO region, we have had some level of training and capacity building along the line for epidemic or outbreak of infectious diseases. But let me take this last opportunity to make a special appeal to the private sector. Um, Really, the private sector has to be an integral part of the response to COVID-19. And I want to ask you, first of all, to help our countries in Latin America and the Caribbean to resolve what is the greatest and most immediate challenge that we are facing. And that is the access to quality, affordable COVID-19 tests and personal protective equipment. I want to make a special appeal for the rapid tests, that we can have rapid tests of high quality and sufficient quantity to address the needs of this pandemic. And I want also to ask the private sector to please work with governments to make available the resources that you, the private sector, have at your disposal to support the response. And finally, to the private sector, as the pandemic proceeds and millions are economically impacted, and work with our partners. So I would like you to work with our partners and with governments to strengthen the safety nets for all, but in particular for the most vulnerable. I do believe that a person's health coverage should not depend on whether she or he has a job. Access to health services for the family and community should not depend on the economic status of the family or that community. We need we need the might of the private sector if we are going to effectively address COVID-19. And let me once again call on all our sectors to join. It's only in a unified manner that we will be able to successfully confront COVID-19. Thank you again for attending this media briefing, and we hope to see you next week. Thank you.
Muchas gracias, doctor.
Thank you very much, Dr. Etienne. We have come to the end of today's session. We apologize for not being able to answer all the questions. We will be briefly sending the director's opening words as well as a recording of this session, and you can continue in contact with us through the email mediateam@paho.org, and we'll be answering as soon as possible. Thank you all, and stay safe. Thank you.